My name is Neema. I attended UC Riverside, and I was a bioengineering major, and I got my bachelor's of science last June. In the future, I hope to become a physician. I'm leaning more towards orthopedics, but through my experience at RCH, I kind of want to go more towards OBGYN. I've been in the program since 2015D, so November 1st of 2015. This past year, I just completed my Master of Science degree in bioengineering. I learned a lot about it, but it really doesn't define what I want to do in the future. I personally wanted to pursue a Master of Science in Bioengineering just because I love the field. I love bioengineering. I love how there's so many solutions out there, so many innovative ways to approach healthcare. Not even just from like the cellular aspect, the micro environment of biology, but also from a macro aspect and how it relates to healthcare. And I feel like I didn't really get enough of that in undergrad, which is why I wanted to pursue it as a master's degree, and hopefully it'll help me in the future. So honestly, pursuing a graduate degree before a medical school or nursing school, any type of like health professional school, honestly, in my opinion, is not necessary. Only pursue it if you really have an interest in the field. And you really do want to do something with it in the future. You really want to know more about it. Essentially, I feel like that's what a Master of Science is. As far as my motivation to join the Health Scholar program, when I was a freshman at UC Riverside, I kind of really didn't know what I wanted to do. I felt very lost. A lot of the people I interacted with, they said, oh yeah, I want to go to medical school, I want to become a nurse, I want to do this, and that, and I thought to myself, like, I'm doing bioengineering, I do want to do health, but what is it that I really want to do? And then I joined a pre-health club, and one of my friends was telling me, hey, you should join this program called CCE, now Health Scholar. It's a really great experience, get to rotate through the hospital, really find out what you want to do. And I thought, wow, this is perfect for me. And from there I applied, I interviewed. Honestly, it was a very nerve-wracking experience. It was nerve-wracking for me just because I know I'm very shy. I'm a very reserved person, and it was new for me to enter an environment where honestly people in suits and people in professional clothing really interviewing you in a very serious manner. Like, I'm going to be entering a healthcare environment, a hospital setting. I've never done that before. I was usually more exposed to like high school friends, volunteering in like local communities, but not really in a professional environment. And that's why I didn't know how to act. I didn't know how to talk to people. Like, I didn't know that shaking hands really goes a long way. Saying thank you, having that kind of tact, and really respecting people and figuring out essentially how to behave. That's kind of why I was nerve-wracking. But honestly, over time, through a lot of experimentation, a lot of failure, I feel like I've found where I want to be for the rest of my life. This program, honestly, in my opinion, is designed to help you get your foot in the door for a lot of other professional schools, a lot of other activities in a professional environment. And I keep stressing professionalism because I know that it's really important to maintain that professionalism in the future, especially as a physician, as a nurse, just someone who works in the healthcare workforce. Regarding my interest in healthcare, my motivation routes back to when I was younger. Specifically, I had a family member. She has a birth disability from birth. She couldn't walk correctly. She was very stigmatized, and I noticed that throughout my life with living with her, and the disabilities she had to face, and like she couldn't walk correctly. And I realized the privilege of having working limbs. So, and from there, that's kind of where I realized that maybe orthopedics could be a route for me. I've been a patient as well. I've had multiple broken limbs from various activities, and from there I realized how nice and how respectful the doctors are with patients in general. And I figured that this is like, they really inspired me, and I kind of figured out this is who I want to be in the future. And then eventually when I joined the Health Scholar program, after meeting a lot of the patients I've been with, who've actually, like, their stories have stuck with me, it really confirmed me, like, this is what I want to do. Their stories inspire me to grow as a person in general and really develop empathy, open-mindedness, and which I think has shaped me into a much better person. regarding confirming my career as a physician in the future, specifically it was one patient. So prior to working with this patient, my mindset for the program was coming to attend a 1 4-hour shift per week. You work with the patients, and then by the next week you have brand new patients, you meet new people. But there was one patient in particular who, when I first met her, she had a case of dementia, and she just had a procedure done, and she didn't really notice that I was there, but the nurse asked me to feed her. So, I helped her out, gave her some time, and it looked like she wasn't really paying attention to me, which is fine. Like, that's, I understood where she was coming from. And then after I left, I thought that was it, move on to the next patient. Next week when I came back, I realized that was the exact same patient, and she recognized me. She was much more responsive, and it made me really happy just to see her growth and how she actually remembered me from even a week ago. I mean, she's encountered multiple nurses, other health scholars, and I really feel like I made an impact on her, and then we developed a relationship as a result. And I found that just being there with them, holding their hand, feeding them whatever they need, and really helping them grow, giving them that autonomy, honestly really goes a long way. And for me personally, I found that very fulfilling. I found that very rewarding, and this is the kind of feeling that I want to have when I grow older as a physician. Okay. Compared to a lot of other programs, COPE Health Scholars, especially at RCH, it's a program that really forces you to think on your feet. How to talk to other nurses, how to talk to doctors, how to talk to patients, how to talk to even the technicians, how to talk to people, how to work with them, how to act in various situations, high pressure situations, and even low pressure situations as well. As far as being exposed to all the different environments, I remember I rotated through not just the nursing units, but I went through the emergency department, labor and delivery, and even sterile storage, where I kind of saw like the behind the scenes work with medical care, and how that's really important with delivering optimal care, in addition with the patient one-on-one interaction. And seeing how everything fit together in a hospital setting honestly made me feel personally more comfortable in the environment, but also clarified a lot of questions that I had about what healthcare is in general and how a hospital is run. Because a lot of other volunteer opportunities out there, you don't really get to see how a whole team fits together. You don't get to see how the behind the scenes work in a hospital, and how patient care, operations, surgeries, procedures, how all that fits together, and how everyone works as a team, and I find that really fascinating. Why should a pre-health student join the Health Scholar program? Honestly, we all want to become doctors. We all want to become nurses. We all want to become physician assistants. It's the end goal. But really, do we really know what that is? Personally, when I joined the program, I wanted to find out, what exactly is it like to be a physician? What exactly is it like to work here, to be with real patients? And you don't really get to know that unless you put yourself in that environment. The Health Scholar program is a great place to experiment. What departments are good for you? Where do you fit? What are your strengths? What are your weaknesses? Where do you see yourself? Where are you successful? Things like that. And for me personally, I found that I'm very open-minded. I kind of strengthened it as a result, seeing the variety of patients, seeing the variety of staff members that I work with, and all the friendships and how supportive they are. Honestly, the healthcare workforce is a very supportive environment, even in the leadership team and the Health Scholar program in general. And honestly, it was a great community to be a part of, especially as an undergraduate student. Moving away from home can be very scary, being on your own, things like that. And especially when you have a community like this and a leadership team like this, it really makes you feel like you're part of something. Honestly, during my first rotation, I felt like RCH is kind of my second home, even though it might be a little cliche. But I felt very comfortable here. I look forward to coming to my shifts, and at the end of the day, I felt like I did something. I was useful. I wasn't worthless. Which is honestly something that I was going through when I initially went to college. To me, the reason why Riverside Community Hospital is so special is because We have 20 specialized departments where we have the opportunity to go in there, learn about it, see why each department is so special, see why the staff members there are also, why are they working there? Like, why do I want to be like them when I move on to professional school? And we have a very, I guess, kind of like broad scope here. We have a lot of things we can do, and the thing is that RCH has been around for a very long time. The staff knows us. They trust us to do a lot of things. They trust us to come along with them to see procedures, to talk to patients, to actually be involved in a lot of the patient care processes and a lot of different methodologies that are involved in whatever they're working with. And it was honestly a real treat. I remember my time in the emergency department. I was working on an 11 p.m. to 3 a.m. shift, and one of the technicians let me come into the trauma room and observe what was going on. They had a patient who came in who was he was working at a sawmill, and half of his arm was almost cut off, and he was and then it was very bloody. He was unconscious when he came into the trauma room. And knowing me, knowing my scope as a health scholar, we're not allowed to be in the process of helping out the patient, which I completely understand. So I stood in the back, but I was watching. I was really seeing how everyone came together: physician assistants, doctors, nurses, EMTs, how they all were communicating with each other. And honestly, like, the amount of communication in that room and the teamwork that happened in like 10 seconds was honestly super fascinating. And it's really important because they needed to save the patient's life. And afterwards, when they were done treating the patient, the technician said, "Hey, you can follow the patient to radiology, see the whole process with how the whole process goes." And I said, "Yeah, let's go. I want to learn." And we went, and I kind of observed how after the procedure, the patient went through CT, and they went through X-ray, and the radiologist there pointed out what they were looking at on the screen, and what's important to look out for, and then afterwards how the whole process goes as a result. So I know it was kind of a tangent, but here at RCH again, they trust us with actually viewing all the procedures, being with the patients, immersing ourselves in the environment. And I feel like I couldn't have gained that anywhere else. So currently I'm one of the assistant directors of departments as part of a leadership team here at RCH. Previously I was a quality management coordinator and the department coordinator for the emergency department. I joined the leadership team after my second rotation into the program. And the reason why I wanted to join was because even though I was getting all this clinical experience and even though I was getting all this patient interaction, staff interaction, lots of self-confidence boosting, I feel like I could have been gaining so much more in the program. I know all these leaders, they look so professional, they represent themselves so well, and I wanted to be like that. It honestly was very inspiring. And so I joined. I feel like I had a lot of things I could give back to the team and give back to the scholars, because being firsthand in the program, I felt like there are some things that we needed as health scholars to improve our experience. So that's why I joined the leadership team, and honestly, I love every bit of it. Whenever, as far as being as a department coordinator, really mentoring the health scholars who also do have a passion for healthcare, who do want to learn just as well as I do, and really helping them grow as a result was also very rewarding. And not only was I here as a health scholar gaining firsthand experience in a healthcare setting, but I was also developing my professional development and mentoring. And I think that's honestly very important in the long run, and also for myself to actually, come out of my comfort zone, not be as shy, which I really did want to improve with myself. So being a department coordinator, over time I did develop my expertise. I felt very complacent, but at the same time, I still wanted to give back to our leadership team. I wanted to train our coordinators who would essentially be the face of the program, and further develop not only our program, but also our the healthcare environment in the hospital. So that's why I wanted to join the executive team as an assistant director of departments. And in this role, I found myself mentoring our coordinators. and really developing them professionally, shedding my insight from what I've figured out in the leadership team, sharing my failures and how I came out of it and how they can grow as a result too, and also letting them fail and also come out victorious. And I think honestly, for like self-esteem and self-confidence, that's honestly a very big factor, and in the long run as a future healthcare provider. Okay. As part of the executive team, compared to being a department coordinator, you have more of an opportunity and more of a role in deciding how the program is run. You work alongside other leaders, other peers to run the program, and that's very rewarding to me personally, and like you have more of a say in that perspective. You have to represent yourself more professionally. People look up to you, and honestly, although that is very rewarding, it also helps me become more self-aware as a result. As far as being on leadership, how that has helped me become a better physician in the future, honestly, the skills that you learn in a leadership team, conflict resolution is a big one, teamwork, communication, how to work with people, that's a big thing. And as a physician, you are required to have those qualities. How are you going to work with patients? How are you going to work with other physicians, nurses, other healthcare professionals to ensure that we can provide quality care for the patient? And being on a leadership team has essentially, in my personal opinion, has strengthened those qualities for me. It's brought me out of my comfort zone to actually work with people, state my opinions, resolve conflicts. Honestly, being on a leadership team, especially as in an executive team position, really puts me in an advantage for being a better physician compared to a lot of other physicians that jump into the field. They haven't really been exposed to such a teamwork setting, a team setting, to the point where they have to figure it out. And then I'm not saying that I'm like totally there yet, but I do have an upper hand, and I feel a little more. It's not as scary to enter the healthcare setting in that viewpoint.